It's not me. Check to see if it might say something like an AI note taker. I have an add-on for my Zoom. Sometimes it pops into random meetings.
Yeah, it does. It's there.
Kick it
Um,
out. Like the host has to kick it out. I
yeah.
I gotta figure out a way to get that off of there. It's through an app called Sticky, and it's aptly named because it is very sticky. I can't figure out how to get it off.
Okay,
It's annoying.
remove
Yeah.
Jacqueline's AI note taker. Okay, and I'm not going to report it to Zoom because we know whose it is. Okay,
Yeah.
all right. Okay, so yes, I'm still recording. All right, cool, cool. One time I forgot to turn the recording on about 15 minutes in, and I lost the first speaker of the day. So I've got myself a reminder here to record. We're going to go ahead and get started. I've got 5 after the hour here, so we'll go ahead and get started. Let me share the PowerPoint here. Okay. All right, so welcome y'all to today's Lunch and Learn. This has been a planning effort and a collaboration of the East Region Planning and Policy Council, which is a sub-council of the statewide Policy and Planning Council of DIDD, the ARC Tennessee, and the DIDD East Regional Office. So welcome here today. Hopefully over time, people will take advantage of this during their lunch hour. I'm not having lunch today, but if you are, feel free to take yourself off camera or whatever's comfortable for you so that you can eat and listen. So looking at who is here today, I'm Billy Worsham. I work with the ARC Tennessee. I'm an advocate over in the East Grand region, which is my area of service for the ARC, and chair of the statewide Policy and Planning Council. So, see, Crystal, if you want to go ahead and introduce yourself.
Yeah, I'm Crystal Hicks. I'm the Senior Vice President of Operations at Emory Valley Center.
Absolutely. Thank you, Crystal, for joining us today. Jackie? I'm not sure if you heard me, Jackie. Jackie, can you introduce yourself?
Yeah, were you able to hear me?
No, but we can now.
Okay, sorry. Yeah, I'm Jackie Cantier, and I'm also on SPPC. Sorry about that.
Yes, absolutely. Thank you, Jackie. And I think Jeff is the only one left to introduce. But before I do, let me go ahead and state our purpose. Our purpose of the Lunch and Learn is to connect people and families experiencing disabilities to share resources, answer questions, and help navigate the service delivery system in Tennessee, a very complex and a systems full of gaps. So we are trying to find all kinds of ways to connect and fill those gaps. This Lunch and Learn being one of them. So that is our purpose. And then, of course, over time, we want to hear from you and your ideas, your topics you want to hear about, all those different things. So you can take this, although we host this, I like to tell people that this is your meeting. So we would want you to take ownership of it. So the way we want to connect people and families to the service systems is in this particular Lunch and Learn format is that we would have a minimum of 2 presentations, the first or however it falls, whether it's first or second, there will be a family side, a family presentation or a family discussion, hopefully hosted by a family member or person who receives services. And then the program side of things, all the different programs and advocacy organizations such as Tennessee Disability Coalition, the whole organizational side, the network side, kind of like a single railroad track with two railroad tracks. You got family, and then you have the networks and the programs. So that's the design for these lunch and learns. So today, let's see where we got here. So use chat or unmute. We want to learn about services with Tennessee Disability Coalition, Mr. Jeff Strand. Jeff, thank you so much for being willing to present today. The floor is open and you should be able to share your PowerPoint. I'm going to stop sharing mine. I think I saw in the email that you preferred to share your own, so you go right ahead and take the floor. Thank you, Jeff.
Great, thank you. Let me pull this up.
There you go.
So that's the wrong button. There we go. All right, so hi everybody. Jackie, I apologize. I've just realized right now that I have forever mispronounced your last name, but I got it now. So glad you're here.
No worries.
So my name is Jeff Strand. I'm the Director of Public Policy at the Tennessee Disability Coalition. For those who are unfamiliar with the coalition, we're an organization of over 45 now members, which include both other nonprofit organizations and individuals working to better Tennessee for Tennesseans with disabilities. We do that in a number of different ways. My focus is on the legislature and policy. But we've got a number of more direct service, person-facing services that we offer as well. We have a program called Family Voices that offers peer support, peer-to-peer mentoring, help navigating the complex labyrinths of TennCare and DIDD and our waiver programs. We have a new director there, Ashley Siebers-Bell. She's awesome and amazing. So if that's something you're all interested in, I'm sure I could get you connected with her. We represent the Southeast ADA Center here. We are Tennessee's branch of that. So we provide consultation to anybody in the state about the intricacies of the ADA, the Americans with Disabilities Act. We have a small grants program for other nonprofits to help build their capacity. What else we got here? We have a traumatic brain injury program called Brain Links that is spreading resources around the state to help support folks with a traumatic brain injury. And then we have, it's Workable Tennessee. We just renamed it within the last year, but it's a benefits counseling for folks who are interested in employment, answers questions. It's full of a bunch of brilliant legal minds that can tell you exactly how your employment can interact with your benefits. And then we have all of our friends. So we have a co-op here in East Nashville. Right next door is TN STEP, Autism Tennessee's in the basement, Power Tennessee. So it's part of the things that we offer to our membership is availability within our office, which gives us the opportunity to collaborate more frequently with each other. So that's essentially the Disability Coalition in a nutshell. Today, I was kind of hoping to talk about what I do here, and that's work mostly with the legislature and work in policy. So in that role, so currently right now, from about January to May, I am a lobbyist on behalf of the disability community in Tennessee, down at Cordell Hull, the legislative office building. The other part of the year, I'm preparing to do this. So that's coalition building, reaching out to advocates, developing a policy platform, almost entirely informed by the needs of the disability community. So I'll talk about where our legislation this year comes from, and almost all of it comes from someone who called us and had an issue. And so that's how I think it should work, and I'm really glad that it does work that way. Are there any questions? So I've got as part of the presentation here, I can go as long or as short as necessary, so please cut me off or tell me to keep going. I'll talk about the legislation that we are running this year as the TDC, and then legislation to watch that will impact the disability community as a whole. Those are from other sponsors. Some of them we like, some of them we don't like. So I'll stop there and ask if there are any questions, or otherwise I can go right on through. Cool. All right. So we'll start out with one that has already passed. And forgive me, I have the horrible habit of naming these bills rather than memorizing their bill numbers. If you're interested in any of these, I can look them up on my phone as I go and make sure that you can kind of follow along and find it and learn more about it on your own. But the first one we've called disability placard language. So we got a call from someone maybe in early January, late December, who was reapplying for their disability parking placard, which allows you to park in a handicap spot. And she had come across some language that was outdated and sort of a little bit offensive. Used terms like confined to a wheelchair rather than something like permanently uses a wheelchair. Referred to people in wheelchairs as spastics and arthritics and mental defectives. And that's just, obviously out of date. And she asked us to work on that. And that's something that we offer our membership, but we offer to the entire disability community in Tennessee, that if you have a really good idea and we think that it's something that is doable in our legislative environment, it's what we want to do. So we went forward and went through the code as it relates to a disability parking placard and pulled out that old language and replaced it with something better. And you might look at this and say, that doesn't really have a huge concrete impact on folks with disabilities. And you're right that it might not, but it does have an abstract impact, that the way we talk about things, including the disability community and living with a disability, is important because that informs how our legislators in this right column here do legislation that impacts Tennesseans with disabilities. Often they'll use language that sort of minimizes or makes childlike the existence of disability. And so they produce legislation that's like that. In other cases, they talk in words that imply that people with disabilities are dangerous in some ways. So they legislate that way. So it's important that the language that is in the code is reflective of how we want our legislators to work with the disability community. So all that is to say, this one passed already. So this one went pretty easily through both the House and Senate, passed the Senate and House floor 2 weeks ago now, just waiting on the speaker's signatures and then the governor's signature, and then that one's done. So that one wasn't too difficult. We didn't run into any concerns about anything. Next one is right to repair part 2. As part 2 would imply, there was a part 1 here. So last year, I'll back it up even to where this one came from. Just like the disability placard language, we got a call from somebody out in East Tennessee who'd been waiting 6 weeks to get a flat tire on her wheelchair fixed. And when you can't use your wheelchair and you are dependent on your wheelchair, it means that you can't go to work, you can't go to the community, you can't go to the grocery store, you can't go friends and family's homes. It means you're stuck. And 6 weeks on a flat tire is absurd. So last year, we called around to some other states who had been working on this and got some advice about how to move forward with this. And they said the first and easiest hurdle to get rid of is to prohibit the use of prior authorization before you can even get your wheelchair fixed. So how that would look is if you have a flat tire, you have to somehow, even though you have a flat tire, go to your primary care provider, your PCP, who then asserts in a prior authorization that, yes, you do still need a wheelchair. And then they send that off to the insurance, who liaises with your wheelchair provider and manufacturer, who then sends out a tech who says, yep, it's broken. And they order the part and they come back and hope that that part fixes it. If it does, yay, you've done it in 3 weeks. If it doesn't, now you're stuck for 6 weeks. So last year we did away with the prior authorization. That passed the legislature with not a whole lot of opposition. TennCare wasn't super thrilled about it, but we think that we removed an unnecessary barrier that sped up the process here. So right to repair part 2 is the right to repair part. And this has proven to be a little more difficult this year because it's a bigger bite of the apple. We're trying to do a little bit more with this. And as the name would suggest, this includes the right to repair part. So this piece of legislation lays out 3 ways that you can get your wheelchair fixed, up from 1. So one of those ways is the way that exists right now. It's you have a warranty on your wheelchair, something breaks, you call up your wheelchair manufacturer who will send an authorized technician to fix it. And so that's how it works right now, and that still exists. And that is helpful in some cases, especially with a more complicated fix. The next one that would help folks get their wheelchair fixed is independent repairs. Independent repair persons can now request parts, manuals, software keys to do a number of non-clinical fixes to a wheelchair. So these are things like a flat tire or a broken spoke or a torn seating or something like that, a loose joystick, nuts and bolts that aren't fitting right, that kind of thing. You know, there are some software things that a person who's, you know, good at computers can do. But we're really excited about that one because we think that frees up then those authorized techs to work on more complicated things. And if you're a person who's waiting 6 weeks on a flat tire, you can order the part from your provider or for your manufacturer, take it to your local bike shop and they can install it for you. Unfortunately, we had initially intended that to be covered by insurance. We had to pull out the insurance cover, so that's an out-of-pocket cost. But we're hoping that these are for less expensive types of repairs like a flat tire. And then the third is interesting because it came from wheelchair suppliers. So the entities that sell wheelchairs to a consumer. And so they are very interested in preventative maintenance. And so we included a provision in there that established preventative maintenance visits twice annually covered by insurance. And so this is really where TennCare and the insurance companies had a lot of heartburn about this. They didn't like to be told that they had to pay for something. So we sat down in Representative Hale, our sponsor's office yesterday, and hammered things out. So we are down to one preventative maintenance visit per year, arranged by the consumer. It is still covered by insurance. It's a flat fee for suppliers. So we think we got as much as we could get out of a compromise, and really it just was going from 2 to 1. But we think that that can catch issues before they become big issues where you're going to need an authorized technician. In some cases, they can remote in to the software to make sure things are going okay. They can, you know, check the specs from there. In other cases, they'll, you know, you'll call up your supplier and they'll send out a person to tighten the bolts, change the oil, you know, all the stuff that preventive maintenance entails. So we're excited about this one. So we think we've got the payers off our back, and we're ready to start moving this one. So I'm excited about that one. Hopefully that speeds up the process for folks who need to get their wheelchairs fixed. Pathways to TennCare. This one's actually called the TennCare for Working Individuals with Disabilities Act. Oops, go forward. There we go. And it's essentially a Medicaid buy-in program. And a Medicaid buy-in program is what it sounds like. It's for folks with a disability, a qualifying disability. They would pay a premium and they can access Medicaid services. So those that are here are probably familiar with Medicaid, pretty strict income and asset thresholds that really limit the types and amount of work that a person can aspire to. This would allow folks to aspire to earn more money, to work more hours, to pursue interests, things like that. So this is another one that came to us from a self-advocate who had gone through Representative Darren Jernigan. We've been working on this since about September. And now it is sponsored by Representative Tim Hicks and Senator Bo Watson. Bo Watson's a good friend. He's also sponsoring Right to Repair Part 2. But we're really excited about this. We would be the 47th state to have a Medicaid buy-in program, currently one of only 4 that don't have one. And it really allows folks to live a life of their choosing. So the advocate that we're working with, and he's not the only one, we've had a bunch of folks come forward and say that, you know, this would be a huge deal for us. He is a former Vanderbilt football player. He got 2 degrees from Vanderbilt, advanced finance master's degree, been working in corporate health finance for about a decade and a bunch of Tennessee corporations, learned to love Tennessee, wanted to stay here. Goes out to get dinner one night, skids off the road, and is paralyzed from the shoulders down. Spends 2 years rehabbing, trying to get back, you know, get his life that he had imagined back on track, only to encounter the fact that he can't go back to his old job. He can't do that stuff anymore, not because he's unable to do it, but because he needs Medicaid services. He needs those home and community-based services. He needs private duty care at home. And his insurance, employer-sponsored insurance, would never cover that stuff. So what this does is it allows Robbie the name of the self-advocate, to pay up to 5% of his annual income to access those services, making Medicaid the secondary payer to his employer-sponsored health insurance. And so in all of our research, we see that it saves money in the long term. It allows these folks to go back to work and live healthier lives. And it's an important means of access to the community for a lot of folks. And so we're really excited about this one. We've got a lot of concrete support for it down at the legislature. It's already, I think we're up to 7 co-sponsors in the House. The biggest issue will be the fiscal note. So the fiscal note is the Office of Fiscal Review, who does a lot of math stuff to determine how much they think a bill is going to cost, thinks that our bill is going to be about $18 million in the first year and $10 million each year thereafter. We had estimated about 3 coming from the state. So being apart by 6-fold isn't helpful to getting it passed. So we're going to work with Fiscal Review to talk about our estimates. We had estimated about 500 would enroll in the first year if we're really lucky and we work really hard at letting people know and getting people to trust us that they're not going to be left out to dry. That could get us to 500. They had estimated 3,300 in the first year. We don't think it'll ever get to 3,300, probably topping out at 1,100 or 1,200. So that's a lot of nuts and bolts and weeds to say that we think this is a really good bill, and we think it is far past time that Tennessee provided this option to residents with disabilities, and we think that this could make a huge difference in folks' lives. So the next one, keeping going here, paid family caregiving resolution. This actually, I'm going to talk about ours, and I'm going to talk about another one that's sort of related, but not coming from us. So paid family caregiving resolution is a resolution that urges the state to develop a statewide comprehensive paid family caregiving program and policy. So just a little bit of civics here. A resolution is non-binding. It's more of a feeling or a sentiment from the General Assembly. Should this one pass, we could point to it and say, hey, look, the General Assembly, TennCare, thinks you should do this. We think that it'll be a good thing for folks, and so do they. But it doesn't force anybody to do anything. But when you can establish this legislative intent, it also gives folks a heads up that if they're not going to do it on their own, the General Assembly is willing to do it themselves. So this one passed through Senate Health on the consent calendar last week at Disability Day on the Hill, and is set for the Senate floor. We're still waiting for our House sponsor to move it, but we shouldn't see any problems with this one. We're getting a lot of support for this. We've had some offices reach out and say, hey, I want to be part of this. How can I help? Type of thing. So this is part of a multi-year effort to establish a paid family caregiving program and policy in the state. If TennCare does not agree and doesn't want to work on this in the summer, it's likely that we'll come back next year and have legislation directing them to. And then, like I said, we can point to last year and say, look, the General Assembly already wants it, and it's a good place to start at the negotiating table. Katie Beckett Part A fix. So this one is interesting because we've been working with a lot of families about their experiences in the Katie Beckett program. So we're at year 3 of the Katie Beckett program, and it seemed like a good time to do a state of the program type of get together. And so we talked to folks in Part B who are generally satisfied with what they're getting in Part B, but we talked to folks in Part A, which is really more resembling a traditional Katie Beckett program. It's for kids with the highest level of need. And then, of course, the highest cost that comes with that. So Part B is called the Medicaid Diversion Program. It provides $10,000 that would be available to families to spend on home and community-based services and other eligible disability costs. Part A enrollees are actually enrolled in Medicaid. And I should say, these are children. Katie Beckett is for children. And they are enrolled in Medicaid and then provided $15,000 for home and community-based services. But the big difference between the Part A and Part B money is Part B is a health reimbursement account. You get a little card, you take it and you swipe it, you provide your receipt afterwards, your documentation that proves that you need it, and you're good to go. The way that Part A works is you have to go through your, about 7 minutes left, thanks, Billy. You have to go through your MCO. who goes to TennCare, who says yay or nay, and who goes back to your MC. It's a complicated process, and essentially folks can't spend it. It doesn't work. They can only spend about $5,000. What we hear from them is that it's for assistive technology where they can buy an iPad and it costs them $3,000, which is not how much an iPad costs if you're buying iPads. So we were hoping to fix that. We were really late to the party on this because our sponsors just kind of came to us and said, okay, we want to do it now. We had thought maybe next year. So what we're going to do with this one is we are going to work with a group of legislators and families over the summer to get as comprehensive a fix as possible, set into legislative stone so that we can work on it next year. And we're really excited about this because we think that there's going to be a really big benefit to kids with disabilities, especially the most complex disabilities who are enrolled in the Katie Beckett program. We're doing a big, multi-year push on special ed stuff. And so we've asked the Office of Research and Educational Accountability, OREA, at the Comptroller's Office to study the use of informal exclusionary discipline practices in the state. And so I had a meeting with them this week to say, here's what that means. And so very briefly, that's things like informal removal, where the school will repeatedly call the parent to come pick up the kid in the middle of the day, but then not log it as a suspension, meaning that they can do that in perpetuity without triggering a manifestation determination meeting, which for those who haven't been in one, is essentially a problem-solving meeting that comes after 10 days of removal. And it says, hey, this isn't working. We can work on something else. Oh, okay, cool. Sounds good. Well, I got lots to talk about in the whole hour here. So this is part of a big multi-year push. We had been talking with families last summer about informal removal and their experiences as parents of kids with disabilities in Tennessee schools. They really wanted to focus on these exclusionary discipline practices. So I looked around and said, what other states are doing this well? And I saw that Oregon passed a suite of legislation 2 years ago now that established some really good protections against these exclusionary discipline practices. So the other examples are the inappropriate use of homebound placement. So homebound placement as a result of behavior rather than medical need as it's intended. Or there's a new thing in Tennessee called a threat assessment. And those are, anybody can refer a child to a threat assessment if they can somehow show that they think that that child is going to be a danger to the school in some way. And then the child is taken out of the school indefinitely while they assess how real a threat this is. We've talked to families who have spent 6 months out of a 9-month school year out of school while they try to complete these threat assessments. And it's just a means of keeping these kids out of school without providing them the type of education and services that they're due. So this year, and in the Oregon model, this is what they told us to do, is establish that they exist. I was in the speaker's office once talking about something else, and I mentioned informal removal or push out policies of kids with disabilities, and he said, what's that? Have you ever worked on that? That's not real. That doesn't exist. And so we think it's important before we can address any of these legislatively that we prove it exists. And that is what I told the office, the OREA, this week, is that we'd love to see that you could show that these exist in Tennessee schools. If you can get to their prevalence, how often it happens, that would be great too. But we do have a number of years to go on this. Disability Rights Oregon, who has kind of helped us shepherd our plan through here, told us that it's like whack-a-mole, that if you can address one of these informal exclusionary discipline practices, they pop up in a different spot. And so it's playing whack-a-mole, making sure we can knock all of these down. But you have to start somewhere, and we think this is a great place to start. So with that, that is our TDC platform this year. Does anybody have any questions, thoughts, feelings on those, or should I get over to legislation to watch?
Hey, Jeff.
Yeah.
I would like to, I'm going to send you an email later. The work you're doing with Katie Beckett Part A, we are also seeing that exact issue on ECF side.
Okay.
When it comes to the enabling tech budget is 5,000, but more than half of it in many cases is going to quote unquote procurement fees or training people never get and these kind of things. So it's going to administrative costs, and ECF Choices members are not able to access anywhere near their full budget, sometimes not even half of their full budget.
Yeah.
So I'll send you an email with some examples of that, and maybe we can combine some of the work we're doing on that.
Yeah, absolutely. And like I mentioned, I sat down with Senator Roberts yesterday, who is one of the prime sponsors of Katie Beckett, the original piece of legislation that established the program. And he really wants to meet families and talk about it this summer and come up with something really good. So I think ECF families are, you know, birds of a feather with Katie Beckett families. And if they're experiencing the same thing, we might as well address it as best we can, right? All right, any other questions or anything? All right, so in the right column are pieces of legislation that have come up on our radar that did not come from us, any of our disability advocacy group friends, or anybody that we knew. So these pop up, and we want to work on them with their sponsors. Okay, see you, Jackie. So this first one is, I call it the Brightstone bill. There's a residential facility out in East Tennessee called Brightstone, and they would like to establish what they are calling a pilot program to build new residential facilities and programs for adults with intellectual and developmental disabilities, IDD. However, the means by which they'll do that do away with some of the anti-institutionalization protections that have been put in the code since the closure of the state's institutions. And so one of the big ones is you can't have more than 4 adults with disabilities living in one space closer than 500 yards from someone else. So 4 in a single facility, no other facility within 500 yards. And that was in the telling of those that passed that, disability advocates years ago. That was the easiest means to protect people with disabilities from large-scale institutions. Simply that size and distance did it. So Brightstone would like to do away with that because they would like to build in their telling a sort of dorm-style living for folks with intellectual and developmental disabilities. They argue that this is private pay. They don't take insurance. It's only private pay. Currently, I see that it's about $45,000 a year to participate in their current programs. And they would like to build these facilities out on their big plot of land out in the east. And so our big concern with this is that it does away with those anti-institutionalization protections. It is not community-based. It is, you know, I would guess if it's $45,000, it's not coming from the person who will live there, which means the choice is questionably theirs. And it sets a bad precedent here. There is a strong sentiment and push in the General Assembly to reinstitutionalize folks that legislators see as being harmful to the community. Often that comes to play with mental health need, but also behavioral health, and also intellectual disability. We've seen statistics say up to 40% of folks with IDD have some sort of co-occurring mental health need. And so that's really wrapping up a lot of folks in this. And if we're going to let Brightstone go, that really, as Carol says, it's the camel's nose under the tent, back towards institutionalization. I'm not a fan of the slippery slope argument, but I'll use it here. It's a slippery slope that once you start going down with, oh, Brightstone can do it, why can't someone else do it? And when we look at that option, Brightstone is for likely wealthier families that can afford this, you know, annual tuition to send their adult child with disabilities to what they also called like perpetual summer camp. And it's a pretty reasonable argument from there that if wealthier folks can do it, why can't poorer folks do it? And so we just see this as crossing a line that can't be returned. So we're very concerned about this one. We're working with lobbyists representing Brightstone, the sponsors, to talk about our concerns. But it's really important that the disability community is aligned in saying that you know, institutions are inappropriate in all respects. That is not to say that there is not a need in the state of Tennessee for residential options for adults with intellectual and developmental disabilities, and for that matter, for mental health need and complex behavioral need. That's real, but we believe that we can do that in a more community-based setting that provides more options for folks. So it's one we're watching really closely. I'm sure some of you have heard this one. Private school vouchers, that's a big one going on this year, and it's happening right now in the past couple of weeks here. Private school vouchers are Bill Lee's signature proposal of the year. And it so far is not going as smoothly as I'm sure he would have hoped. So it has passed the House K-12 subcommittee. That's the first education committee it would go through. And then it passed yesterday the House Education Administration Committee. The things going on here are complicated and very middle school-esque. The House and Senate do not see eye to eye on this, neither of whom see eye to eye with Bill Lee either. The House's bill is more omnibus than it is just a voucher bill. The Senate side is a little bit more cautious about it. The House side has a lot of incentives meant to win over skeptical legislators and public educators. And so some of the things that they're offering public educators are to be added to the state's employee health care plan, to pay school districts $75 a child for infrastructure needs. What else they got? They got a whole list of things that is getting really, really, really expensive. Their fiscal note right now is just under $500 million. I've heard other folks on the other side of this argument say that they're estimating more like $1 billion a year for these type of things. And so I haven't even talked about what the bill itself does, but it is kind of what it sounds like. It provides a little over $7,000 to, in the first year, up to 20,000 folks to use towards a private school education. After that, it takes the cap off. And these are universal. There is no income test, no means test, no location necessary as the current program is. This just opens it up to anybody and everybody. And we have concerns from the disability side. When you go to a private school, the types of services and accommodations that you can receive are lesser and less likely to be provided by a trained professional. You entirely lose all of your IDEA rights to those services. There's no such thing as due process anymore. You have access to some services, but they're more likely to be cost-effective accommodations is one way to put it. Extra time on homework assignments or preferential seating, those kind of accommodations. And a private school can accept and reject whomever they want, and they can remove whomever they want. And that would mostly affect kids with disabilities, kids that need more support and cost more to educate. And then finally, we are already short across the state special education teachers and related service professionals like speech language pathologists, school psychologists, social workers, counselors. We are short that already. And if we allow, as this bill does, the proliferation of especially unaccredited schools, which this bill allows, we are going to see that resource peanut butter spread even thinner. And so that will have an effect on kids with disabilities who remain in public schools. Their options will be reduced by no choice of their own, right? And schools will start to struggle to fill those slots or pay for those slots for special ed teachers and professionals. And it'll diminish the effect or the effectiveness of IDEA, the special ed law, and the types of services that they can offer and are required to offer. So it's both a civil rights, services, and a resource problem for the disability community. That's not to say that the public schools have not failed more than a couple Tennessee families with disabilities. That we know that parents know best, and there are instances in which public school is not going to work for their child with a disability. For that, though, we have individualized education accounts, IEAs, which are specifically for kids with disabilities. They're similar to a voucher, and they're a little bit more generous in that they're about $9,000. So this is one to watch. The Senate is getting going with it. I think they voted yesterday. I didn't see how they voted in Senate Ed. It's going to come down to the money, and it's going to come down to whether or not the Senate and House can see eye to eye. One of my concerns about this is that the House will pass their version and put it in their budget. The Senate will pass their version, put it in the budget, and then they go to what's called conference committee, which is unaccountable, private negotiation where they try to make two bills match up that have already passed. And so then nobody really gets the good opportunity to scrutinize it publicly, and it's not particularly democratic. And then it'll go to the governor's desk, who has his own ideas, but I'm sure is willing to take a win where it comes to his desk. So one to watch. It's difficult to have a real strong impact in this because it is so controversial. And there are a lot of national eyes and dollars involved in this campaign, and it's been going for a while. So when we talk from the disability perspective, it's, I say, important to stay in our lane and know our concerns and stay within our concerns rather than getting wrapped up with some of the other talking points and arguments that are outside of our lane, if that makes sense. The Tennessee Disability and Aging Act, that's one that the disability and the aging communities have been working for over a decade. And this combines TCAD, the Tennessee Commission on Aging and Disability, and DID, DIDD, y'all know what DIDD is, into one department. And it's tough to describe the benefits of this without using corporate speak, but it allows, so I'm going to use it. It allows for better streamlining of services, the more effective and efficient use of resources, the ability to cross over between disability and aging more seamlessly. But it essentially elevates issues with aging to a department level while maintaining the types of services that DIDD already provides. So we think it's a win-win for both communities. Money is protected where it is. It's not going to, the aging community isn't going to take money from the disability community nor vice versa. So this is a good thing. And we haven't seen any opposition to it yet. And I foresee this one passing pretty easily. And it's an important step towards both improving both worlds of service here for both Tennesseans with disabilities and aging and those that fall in between. Print disability ballots. This one and the previous one are brainchildren of our good friend, Senator Becky Massey. So this one, she said she got a call from someone who really wanted to be able to vote absentee because of the nature of their disability, but could not use the absentee ballot because they had a print or a print disability visual impairment. They were blind. And so what this does is it provides a mechanism by which a person who has a visual impairment or is blind can, request an accessible absentee ballot, and it makes them eligible to use that ballot. And so it's a big step forward to expanding the, what's the term? Expanding access to the ballot box. And I think it's a good step kind of away from these restrictive pieces of legislation that make it really difficult, especially for folks with disabilities, to vote. So we're excited about that one. I haven't seen much opposition to this as well. I think election restrictive types of legislation are a little bit out of vogue, especially with education and vouchers on the table this year. So I think this one has a pretty good path forward. And given the fact that we have some of the worst voter turnout, both folks with and without disabilities in the country, I hope this will improve Tennessee's standing in voter turnout. Excuse me. All right, I got a few more here and I'll try to go through them sort of quick. Oh my goodness, look at what time it is. All right, involuntary commitment. So this one is tough to talk about because it is tragic and there needs to be a fix, but we don't think this is the fix. So this one's also referred to as Jillian's Law. It is meant to address the accidental murder of, I can't think of her last name, Jillian, who was a freshman at Belmont last year, was out walking on a walking path and was hit by a stray bullet and died. And so that, excuse me, that stray bullet came from someone with an intellectual disability who was recently found incompetent to stand trial. And so the issue here is that this is a person who was not getting preemptive community-based services. And we don't have a community-based option for him should he be found incompetent, if we want to help him, to support him and to avoid interaction with the criminal justice system again. We likewise don't have supportive beds. So if this person needed more acute psychiatric care, I think we only have 4 in the state for folks with intellectual and developmental disabilities at the Bryce Jordan Center. Harold Jordan Center, Bryce Jordan Center is where Penn State plays basketball. Harold Jordan Center. And so what this bill does is it allows folks that have intellectual disabilities who've been found incompetent to stand trial to be involuntarily committed seemingly indefinitely. The only ways that one could get out is to restore competency, which is language that's used in the mental health community, but is not particularly applicable to intellectual disability. An intellectual disability is an intellectual disability. You don't become less intellectually disabled by other means. Supports and services can help folks with ID thrive in the community, but it doesn't change this idea of competency. Or if competency can't be restored, one can be required to do, it's called mandated outpatient treatment, MOT, which sounds great, but we don't have that. We don't have that in the state. And if we were to do it, a person with ID who's been found mentally incompetent to stand trial would then be entitled to these mandatory outpatient treatments for the rest of their life. And that's really, really expensive. It's not a bad thing, but it's really, really expensive. And so that means that the default would then be keep them involuntarily committed in an institution, hospital type of situation. And so that's very concerning, because that's that same idea as Brightstone, that these folks are dangerous, or these folks need someplace to go. They can't be here in our communities. Here's a coercive means to get them there. Voluntary student retention is what it sounds like. It provides an opportunity for kids with a diagnosed disability to keep their child in the same grade, retain their child in the previous grade if they think that's the best move for them. In theory, IDEA should support a parent in doing that. An IEP team is allowed to make this decision, but IDEA is a little fuzzy on retention for students with disabilities. So this would not supersede IDEA, but put the power back in the parents' hands to decide, I think my child would benefit from another year of, say, second grade. And we think that this is a good thing. I don't think that as a whole, retention is beneficial for a lot of kids, but for some kids it is. And we'd like those kids and their parents to have the opportunity to make that choice. Alternative housing licensure. This is another Becky Massey bill. This one has been in the works for like 3 years. And so previously they had a big complicated bill come out of TCAD, which is soon to be defunct, that would have established some new residential categories. And believe it or not, the industrial sprinkler lobby came out and killed it because it allowed for non-licensed sprinkler installation. And then they tried to get off the ground again last year and it couldn't get there. And so this year takes a different approach to this and says that there are now these 2 tiers of homes for the aging, is what they call them. Tier 1 is 3 or fewer unrelated folks with disabilities or aging folks living together. They have a different standard of inspection. So this is more like making sure stuff isn't rotting in the fridge. 4 or more, excuse me, 4 or more requires sprinklers and things like that. But this allows for more and community-based settings for folks who are aging and want to live in a place like this to find them. They're currently few and far between. We hope that this allows for more, for an organization to buy up a home and help folks living there and be properly licensed. TBI coverage parity. This bill requires that traumatic brain injuries are covered in the same way that Medicare covers them. It requires these private insurance to cover them the same way. And that's important because a lot of them don't cover care for traumatic brain injury at all, or they step therapy their way through it. So we think that this is important for folks with a TBI. And then there's paid family caregiving permissions. This is the one I meant to talk about last time. This is Antonio Parkinson and Senator Richard Briggs put together one that says TennCare cannot prohibit a family member from being paid through an agency to provide care to someone living in their same home. So TennCare unofficial policy is you can't live in the same home as someone you care for and get paid for it. This, with some watering down from opponents of it, allows that in some circumstances. And so it doesn't do a whole ton, but it does establish in the code that someone can't be excluded just based on where they live. And we think that's a great start towards our paid family caregiving efforts starting this year and continuing on next year. So once it's in the code, it is no longer this weird unspoken policy. It's in the code. That means we can move forward a little more easily. So that's what I got. I got all these other scorecard things. I didn't know how long I was going to talk about stuff. I'm not very good at that. But I'm happy to share this, and you can take a look at what our scorecard said this year. And you'll note that some of our homework that we have asked the General Assembly to do is found in the legislation that we're running this year. So with that, questions, comments? I know I didn't leave a ton of time. Sorry. All right.
Hey, Jeff.
Hey.
Thanks so much for sharing all this information. I am so glad I was able to jump on and hear it. I thought I had a good idea of all the things going on, and you have given me all kinds of new information to think through. And thank you for spending time with us today. Billy had to jump off, and so I will be glad to do the closing round to see if anybody has any questions. Although we typically end at 1 p.m. If you know there's questions, we can run over. And lots of folks use this platform to watch our recordings and that sort of thing. So no issues with running over if there's any questions. So wanted to check in to see if anybody had anything. Okay, good deal. Well, thanks again, Jeff. I can't tell you how much we appreciate the information and especially appreciate all the work you and your team do to keep a close watch on how our regulations and our systems support people who experience disability. I did have one that just popped into my head. I didn't know if you guys were watching or working on anything around the Medicaid reapplication, financial determination process at TennCare. Is there anything on y'all's radar around how that process is going? Are we seeing any trends in lots of disenrollments from TennCare with the end of the public health crisis?
So we've been watching that pretty closely throughout the summer. Most of what happened in the spring and the summer were those automatic redeterminations where someone is eligible for a different benefits program, so they can look at that and say, you know, if you're eligible for SNAP, you're still eligible for Medicaid, that type of thing. This fall is when they got to the actual redetermination parts. I think at last I looked, there were a little under 50,000 folks disenrolled based on their, you know, their redetermination process. I know that the Tennessee Justice Center is in the process of a lawsuit to stop or slow this down because they think the redetermination process was unfair for folks with disabilities. So that's ongoing, and I think that's really slowed down the redetermination process. So in some respects, that's a good thing for folks that can maintain their eligibility while we make sure that the processes we're using are good and acceptable and work for people with disabilities. And it fixes the system if it needs fixing. So I haven't seen any trends about kind of like who has been disenrolled, but I understand it to be mostly income and asset eligibility.
Okay. Well, I certainly appreciate that. It's one of the things that is always top of my radar. It's a challenge in the disability community for sure to get folks through that process. That might be the understatement of the decade. And it always worries me about those folks who don't have disability professionals tied to them to help them navigate the program. And so I'm always worried about what's happening to folks out there who may not have that kind of support. So I certainly appreciate your update on that. And with that, I think unless there's some additional questions, we could probably wrap up. And I certainly, again, have found this information to be really helpful. And I can't tell you how much we appreciate you spending your time and expertise with us today.
My pleasure. Happy to come back anytime. I put my contact info in the chat and a link to that presentation if anybody wants to follow up.
Very cool. Thank you so much. I hope everybody has a wonderful day. We'll see you guys next month. I believe that we have a seating and positioning at DIDD on the agenda, and someone else who is eluding me at the moment. So we'll see you guys this same time next month. Have a good one.